Definitely looking forward to that. And every year on National Suicide Prevention Month in September, mental health advocates, survivors, friends and family and mental health organizations across the country and around the world share their experiences and work towards eradicating this most tragic act. Suicides are preventable. Much can be done to prevent suicide at individual, community and national levels. Tonight in studio is a co-petitioner in efforts to decriminalize suicide in Kenya. Charity Muturi, many thanks for joining us.
Thank you.
Now,
glad to be here.
I'll begin with your personal story. Share with us a little bit on your journey in overcoming suicidal thoughts.
Okay. I have grown up in a loving family, but I had a lot of low self-esteem growing up as a child, which continued during teenage and adulthood. And at 14, I started having suicidal thoughts. I didn't know why, but I knew it was religiously wrong, so I did not talk about it. In 2015, I was diagnosed with bipolar mood disorder, which I know you've talked about on the show. And even then, I did not talk to the doctor about it for 3 years because I had learned that talking about suicide is a crime. That's what I had been told, but later I learned it is actually the attempting of suicide. Since then, we have support groups where we've been dealing with a lot of families that are ostracized by the community. If it is people who've died by suicide, they are not buried, for example, they're not given burial rights. We have a case of a young man who was hungry, he hadn't eaten for 3 days, and so he went to a kibanda at Mudhurwa, ate, couldn't pay, and then he was beaten up. And he was able to find a weapon, he tried to take his life, he was beaten up even more. And then he went to... he was taken to the health center at Kamukunji, and they said, we can't treat him without a P3. So he had to go to the police station, come back in wounds and cuffs, and then spend 2 days at the police station again, get to court, prison, and so on. And after that, we were not able to trace him. And the reality is that we have a lot of people who, you know, even get into the system, get out and complete.
And, you know, thanks for sharing that. So a lot of people, essentially what you're saying, are suffering in silence. Now, your personal story, Charity, did this then prompt you or encourage you towards the push now to try and decriminalize suicide in the country?
Yes, it's actually suicide attempt. It's suicide attempt that is the crime. And like I said, we are limited in talking about it, so I can only mention the things that are open to the public. But yes, it drove me to that because, you know, we have groups, patient groups that total to over, you know, almost 1,000 people, and many of them are not able to talk about this because it is a crime, but it is also religiously and culturally wrong.
And let's discuss the prevalence and what do we know of the numbers and how serious an issue suicide attempts are in the country, and indeed suicides.
Okay. As the National Task Force on Mental Health, because I served in the task force, we acknowledge that we don't have a national mental health survey, so we use global statistics, which is, you know, one in every 40 seconds someone dies of suicide and so on. And so we recommended to have a national survey so that we know how many people are dying by suicide and so on. But because of the culture that we have around suicide, there's a lot of, you know, corruption around the cases and so on. But what we are saying is that we have a strong case. It is continuing. We cannot talk about it, but we want to talk to our religious leaders, our cultural leaders, to destigmatize it, but also to begin to put funding where it's needed so that we are able to get help. And
there's concern about the rehabilitation and the treatment facilities in the country. A lot of hashed talk about what actually happens in these facilities and whether at all these people actually do get better, because we're talking about this as a public health issue. And not as a criminal issue. Yes, we're saying, I mean, there has been research done on people who've died by suicide, psychological autopsies done, and it was seen that, you know, over 90% take their lives because of a mental health condition. Do we get better? Yes.
When the doctor finally, gave me confidence that she wouldn't report me, and I talked about my, suicidal ideation, that has never stopped, by the way. For some of us, it's something we have to deal with for life. Then I started suicide prevention therapy. That has been helpful, and I'm able to, address triggers. So yes, we do receive help. Like personally, I'm in treatment. I take medication. I go for therapy when I can afford it. Emotional support through peer support groups and so on. And now we're even engaging religious leaders, cultural leaders. So we have people like Sheikh Lithome, Reverend Tom Otieno, ACK, even the chair of Njurinjeke. I spoke to him and he said, yes, we need to stop beating people who are already on their knees. We need help. Mental illness is a non-communicable disease. When I take my father for treatment for his heart condition and his pressure is high, he's given the right to emergency treatment. And that is what I lack as a person with suicidal ideation. So we need help. But the other thing is that the previous Mental Health Act allowed the police inspector and the chief to hold someone for 72 hours when looking for help. The new act requires that our mental health board that is now in place to put in a system of emergency treatment so that we say, when I come and I'm sick, where should I go? Who will pay for that bill? Who will take me to the hospital? But also to say WHO and the UN, as they have called upon all countries to decriminalize suicide by 2030, and we are one of the only 20 countries remaining, have also said we need care at the primary healthcare level.
A colonial, this is a rule that was, or rather a law that was put in place during the British colonial era.
Yes, and actually most countries that still have the law were British colonies before. And they decriminalized it as soon as we got our independence.
And then let's talk about where to get help, because fundamentally, for anyone watching, the question would be, if at all I have these thoughts and I feel troubled, or I know a loved one, where can I get help? How can I get help? Is there a helpline?
Yes. The Ministry of Health is working on a suicide prevention specific hotline, but at the moment we are using the Red Cross and Ministry of Health counseling hotline, which is 1199, and that should be sort of the first go-to. The second thing is across the world we are pushing for health at the community healthcare level. The Nairobi County Mental Health Department, which we have been developing the 5-year mental health action plan, has already about 40 facilities at the primary healthcare level, at the Lunga Lunga Health Center, Kariobangi Health Center, Kibera Health Center, for people to be able to access psychotherapy. Because we are saying when we address issues while they are still young, before they grow, because I am a patient of Madari, and people come for treatment 20 to 30 years after their first known symptoms. And where are they for those 20, 30 years? In the church, in the mosque, in the traditions, and not receiving treatment. So we are saying, for our community leaders, our cultural leaders, our religious leaders, let us understand that mental illness is a non-communicable disease. And so the same way we treat and pray, when I have diabetes, is the same way we should treat and pray. So we need them to intervene and refer. Well said, Charity. And to close, your call to action. Number one is to call upon the Mental Health Board to put in the regulation of emergency services, and also to include us. It's not properly constituted because we have not been included as persons with lived experience. We are calling upon government to do a national survey so that we know the exact figures on the ground. Yes, we need mental health funding, according to WHO, 250 shillings per capita, for every Kenyan towards preventing this. To religious leaders, traditional leaders, let us begin to prepare safe spaces for us to be able to speak. At 14, I couldn't go to the church, I couldn't go to school or wherever to talk about it. So let us open up this conversation. And lastly, as guided by WHO, look, listen, link. Look for what? Ways to prevent and to prevent and manage mental illness. Listen without judgment. You may not understand why I'm taking my life because I have been left and you've remarried 4 times. Mental illness is irrational mood, irrational thought, irrational behavior. It should not make sense to you because it is irrational. But take me, link me to where I need help. So we need counties to open up mental health services so that, you know, just like I can go to 40 facilities in Nairobi, I need to be able to do the same in Isiolo, Meru, and so on. And lastly, nothing for us without us. Where decisions are made, we need to be on the table.
And many thanks for that, Charity Muturi. And indeed, there is help for you. That it's a toll-free line, which is 1199. 1199. So if you have a loved one that needs help, or if you yourself are not feeling okay, the number to dial is 1199. There'll be somebody on the other end of the line to talk to you, to listen to you, and to tell you where to get help. We're taking a very short break. We're back with much more. Stay with us.